Welcome to this October 19th, 2023 webinar recording from California Department of Healthcare Services, facilitated by WestEd. Audio descriptions have been added for people who are blind or visually impaired.
Welcome everyone to this afternoon's workshop today. We're glad you're here for today's workshop, which is titled LEA BOP and the Time Survey or TSP List. As a reminder, LEA BOP stands for Local Educational Agency Medi-Cal Billing Option Program. Next slide. We're going to start with some introductions first. First, we have the staff from the Department of Healthcare Services and the LEA BOP operations team. As I get to your name, please feel free to wave so folks on the call know who you are. So from DHCS, we have Sarah Brakowski, Monica Velasco, and Stephanie McGee. Regina Zerna is not joining us today, but she is here in spirit. From the WestEd team, we have Jeremy Ford, myself, Lisa Eisenberg, Lisa Morris, Hannah Jarmolowski, and Tara Bergfeld. Next slide. This workshop is part of DHCS's efforts to increase understanding about the LEA BOP and improve program participation among LEAs. If you are new to the LEA BOP, please note that we hosted 2 introductory workshops from earlier this calendar year in March and April. Those workshop slides and recordings are available on DHCS's website, and we're dropping links to where you can find them in the chat. So the goals for today's workshop are building off of that those introductory workshops with more specificity about program components. And the goals for today's workshops are for participants to understand, 1, the primary purpose of and requirements for an LEA's Time Survey Participant List, or TSP list. 2, why an accurate TSP list is so important for LEA BOP. 3, best practices for maintaining an accurate TSP list. And 4, why it is important for TSPs to respond to moments. Next slide. Here is our agenda for today's workshop. This is what we'll be covering in the next hour. So we'll begin with an overview of what the TSP list is, the role it plays in LEA BOP, and requirements for certifying and maintaining an accurate TSP list. So that's the first bullet. Second, then we will cover some best practices and describe how to address some special circumstances that you might be experiencing at your LEA. Then we will pause to answer questions that have come in through the chats. And finally, we'll close out today's session with some next steps that you can take. We want to encourage you to use the chat field throughout today's session to submit questions throughout the workshop. We do have folks monitoring that chat field and noting the questions submitted via chat. And we will either respond to those questions during today's training when we get to the Q&A or in writing after today. And presentation slides and a recording of today's workshop will be posted on DHCS's website in the future. And participants will be notified via email when those slides and recording are available online. Next slide. So now we're going to move into some of the specifics about the TSP list and requirements. Next slide. Before we jump into all those details, we're not doing a full introductory webinar, but we wanted to re-ground everyone with an LEA BOP overview and reiterate how LEAs receive funding through the LEA BOP program. So the graphic on your slide is a simplified overview of the process of the LEA BOP program. So from left to right, first, LEAs deliver services through allowable practitioners employed or contracted with the LEA. Then LEAs submit claims to Medi-Cal for those covered services. Then LEAs receive interim reimbursements for those allowable services throughout the school year. Then LEAs reconcile actual costs with any interim reimbursements received through the cost report. Those actual costs are then audited to verify that they are allowable expenditures. And then the process concludes with a final audited payment within 3 years of the submitted cost report. And again, all of these steps and details about what's included in these were covered in those two introductory workshops we hosted earlier this calendar year. And we encourage you to check out those workshops for more details about the mechanics of the program. So to tie this overview to today's workshop topic, your LEA's TSP list or time survey participant. So your TSP list is used to calculate your LEA's cost in the cost report. That orange arrow pointing to the fourth step in that overview process, which is where you certify your costs through the cost reimbursement and comparison schedule, or CRCS. So now that we've given you that overview, I will turn it over to my colleague Jeremy, who will walk us through more details about the TSP list. Next slide.
Thank you, Lisa. So the TSP list is the list of all eligible practitioners that delivered cover services to students. These are only the LEA's employed staff. There are a couple different ways that TSP lists are processed, but the most important thing to note here is that you should work with your local educational consortium, or LEC, to submit, review, and certify your LEA's TSP list. If your LEA's costs do not include employed staff and only contracted services, then your LEA falls under Model 2. You'll need to fill out a Model 2 certification form, and then there will be no practitioners on the TSP list because practitioners are employed by the contracted agency and not your LEA. There's a policy and procedure letter, or PPL, on Model 2, and we're dropping a link in the chat to that PPL. You may also have a mix of directly employed practitioners and contracted staff, which would not require Model 2 certification. However, still similar to Model 2, contracted practitioners are not on the TSP list, only LEA employed staff. That's what a TSP list is. Next slide, please. Okay, so what's the purpose of the TSP list? The TSP list is a key component for how funding is calculated that an LEA will receive through participating in the LEA BOP. And we'll explain why by showing how the TSP list connects to key components for the cost and reimbursement comparison schedule, or CRCS. As a reminder, the CRCS is one of the most important compliance documents for the LEA, and where your LEA certifies the cost of providing covered services to students. This determines what an LEA receives in the final settlement. So, following the graphic on the slide, one, all eligible practitioners employed by your LEA are on your TSP list. Those practitioners on the TSP list participate in the Random Moment Time Survey, or RMTS. The RMTS is the time study mechanism that California uses to determine the amount of time spent on activities throughout a participant's workday. Eligible practitioners will receive a notification to respond to a random moment, which captures what they're doing in that 1 minute of time. Those responses are then coded as covered activities, which creates 3, the direct medical services percentage, or DMSP. The DMSP is simply the percentage of time spent on those covered activities. Finally, 4, the DMSP is included in your CRCS to indicate what portion of practitioner costs are spent on covered activities. It's important to be aware that every practitioner included on the TSP list impacts the DMSP through their responses to the random moment. Without a TSP list, you cannot calculate the time a practitioner spends on covered services, which is the whole point of the DMSP. It's also really important to note that there's a program requirement that all practitioners must be on the quarterly TSP list that corresponds to the cost by quarter of the CRCS. This is very important. For example, if you plan to include a practitioner's cost for the full school year on your CRCS, that practitioner must also be on all 4 quarters of the TSP list. A different example is if a practitioner is hired midway through the school year, and then you only include them on the latter half of the CRCS, and they would need to be on quarter 3 and 4 of the TSP list. Just to reiterate that point, the TSP list following this graphic is how employed staff get on the CRCS and your final settlement. Next slide, please.
The next slide, titled Why an Accurate TSP List is Important, includes a cartoon illustration of the entrance to a venue named the CRCS Club. The club's padlocked door is further guarded by a rope barrier and a club employee who uses the TSP list they are holding to determine who can enter the club. Text beside the illustration reads, "You can't get into the CRCS unless you're on the TSP list."
Hopefully explaining the purpose of the TSP list helps you understand why maintaining an accurate TSP list is so important to the program, but we want to emphasize some of those reasons here. First, as mentioned previously, LEAs only can include practitioners' costs on the CRCS if those practitioners are included on the TSP list. I'm going to reiterate that several times because it's very important. There's a PPL that covers this requirement, and we're going to put that in the chat now. This is PPL 20046. And if practitioners are not on the LEA's cost report, the LEA isn't getting reimbursement for that practitioner. Second, as LEAs experience staff changes throughout the year, it's important to update the list when there's staff turnover or changes occur. Next slide, please. I will now cover some requirements for an accurate TSP list. Participant Pool 1 is a list of staff who provide covered direct medical services. If you're participating in ESMA, you may also be familiar with Participant Pool 2, which is for anyone that provides administrative services. Because this training is focused on LEA BOP, we will not be covering Participant Pool 2 during today's training. We're just going to focus on Participant Pool 1. To maintain an accurate TSP list, make sure the practitioners include, Make sure the practitioners included meet the credentialing, registered, or licensing requirements under LEA BOP. Make sure the practitioners' job titles on the TSP list match eligible practitioners covered by the program. If they do not match, they can be rejected or dropped from the list unless you submit an equivalency form. There is an option to submit a TSP equivalency form if an LEA's job title is different than the LEA's practitioners list. So an answer to one of the pre-workshop quiz questions that was a little tricky is a practitioner without a matching job title may be included on the TSP list, so long as the LEA submits an equivalency form. For example, an LEA may employ a paraprofessional that functions and is trained as a trained healthcare aide. The LEA can submit the equivalency form so that paraprofessional can be correctly identified as a trained healthcare aide. LEA should submit the equivalency form at least 45 days before the start of each RMTS quarter. It's important to stick to the deadlines for updating the TSP list. All participating LEAs must contract with a local education consortium or LEC that we mentioned earlier. These LECs run the RMTS process. The LEC's role is to request updated lists from participating LEAs, and this is approximately 45 days before the start of each RMTS quarter. If your LEA has practitioners providing targeted case management at the same time as you're submitting these or certifying the TSP list, you'll also want to submit a TCM certification form for your LEC. TCM is a specific set of services with very specific requirements. So we're linking that section in the provider manual in the chat to review before submitting any TCM certifications. The key here is to make sure to fill out an equivalency form if needed and update the list within the 45-day deadline. Next slide, please. So what exactly is the equivalency form and how can it help you? I want to help you. On the previous slide, we mentioned the 45-day deadline as part of the submission process for the TSP list. The primary purpose of the equivalency form is to make sure that you're able to include all of your eligible staff on your TSP list. What I'm about to say next is covered in PPL 20031, and that goes into details around the requirements, but the short version is the LEA BOP has approved specific practitioners by job titles. If your LEA does not use those job titles, you will need to complete an equivalency form to include them. We're dropping the PPL in the chat that goes into the details. I want to give you a couple real world examples where an LEA might have someone on staff that they feel should be billing LEA BOP, but their job title is not on the approved list. Example 1, a very small LEA where there's a school principal was listed as the official job title, but she is very much a qualified school psychologist providing eligible services to students. Another example might be what you would call a behavioral health intern, who is also qualified and providing services as a registered associate clinical social worker. In both of these examples, first you make sure that this person is eligible under LEA BOP by checking the provider manual, and second, you will want to complete that TSP equivalency form, which we're linking now. Also, it's a great idea to use the Pool 1 TSP practitioner qualifications sheet that DHCS has created to double check the approved job classification. Job titles not on the list, but who are still eligible practitioners will need to have a completed and approved equivalency form to be included on the TSP list. And we're putting that resource in the chat as well. We don't want the difference in their official job title at your LEA to get in the way of the great work they're doing in LEA BOP. To complete this form, you just answer a few of the questions, certify the form, and submit the request with the subject line, Pool 1 TSP equivalency request to the RMTS mailbox, rmts@dhcs.ca.gov. Just to reiterate the point of this slide, the primary point is we want you to include all your eligible staff, and just having a job title difference shouldn't get in the way of that process. Great. Next slide, please. Now we're going to cover some best practices and special circumstances. Lisa and I will bounce back between them. So next slide, please.
And I think I'm the first one that you bounce the ball to. All right. The first best practice is to thoroughly review and update your TSP list quarterly instead of annually. LEAs have to submit a TSP in August, like it's your first list of practitioners, and then certify that that TSP list is accurate quarterly. So we're dropping a link to a PPL, PPL 20008. That describes how you as an LEA are certifying in that process that you made all the appropriate modifications to the list and that it accurately reflects eligible practitioners that are employed by your LEA. So that's the requirement. And again, we're dropping a link to that PPL in the chat. And I'm also going to explain a little further why adhering to this requirement and taking full advantage to update the TSP list quarterly in October and February is also an opportunity for your LEA. So first, it's an opportunity for you to remove staff that are no longer employed by your LEA. So when the moment is assigned to someone that isn't providing services because they left the LEA, you lose that opportunity for a possible billable moment, a possible moment where that moment can be coded as covered or not covered under this program. And that impacts the entire RMTS results. And adding new staff when you hire them midway through the year ensures that they can be included on the CRCS. We've mentioned that a couple times already. You have to be on a TSP list to be included on the CRCS, and you have to be included on the CRCS to get those costs accounted for. And so you as an LEA receive reimbursement for their time delivering covered services. And then finally, missing these updates between quarters can directly impact your ability to claim the reimbursement you're eligible for. So on top of the quarterly updates, and this is an interesting, well, yes, we're clarifying a little bit one of the questions that came in through the chat. But on top of those quarterly updates, I want to mention it's important to maintain and update an internal list that you will pull from when you update those TSP lists quarterly. So whenever there is a staff change at your LEA, it's an opportunity for you to update that internal list of who is an eligible practitioner hired by your LEA, not just when you resubmit your TSP list quarter. So you're not scrambling at the start of, before the start of each quarter to figure out which staff to add or remove from your TSP list. So some ways to do that are to work with your HR or payroll department and practitioner supervisors to know when new staff are hired or staff leave. Like have a check mark on your onboarding process that makes sure you add them to your internal list of eligible practitioners. And then this will also set you up for success, and as I mentioned, decrease the time crunch before you have to submit or certify the list for the next quarter. So I will turn it back over to Jeremy, who will present the next slide.
Thank you. The second best practice is to consider how much time your time survey participants spend on LEA BOP eligible services for students. Remember, everyone on your TSP list may receive random moments asking what type of activity the practitioner is doing at that moment. Those moments are coded as allowable or not under LEA BOP. So it does matter whether your time survey participants are actually providing eligible services or not. On this slide, we illustrate how this works. Let's say you have two groups of practitioners, both on your TSP list. Each receives 10 random moments to respond to. Group A spends a lot of time providing direct services, so 8 out of 10 of their moments are coded as eligible. Group B does spend some time providing direct services, but not as much as the other group. Only 1 out of 10 moments are coded as eligible. These moments are all pooled together, so the DMSP for the region would be 45%.
In other words, 9 of the 20 moments randomly surveyed across the entire example region were deemed to be eligible services, resulting in a direct medical services percentage, or DMSP, of 45%.
So there is a consideration LEAs and their RMTS regions should make regarding adding all eligible practitioners to the TSP list compared to adding practitioners that spend most of their time on LEA BOP covered services. Next slide.
The third best practice is to only submit interim claims for practitioners on your TSP list. Since an LEA only receives a final reimbursement for staff costs included on the CRCS, and working backwards, and you can only include staff on the CRCS that are on your time survey participant list, you should not submit interim claims for any practitioners that aren't on that quarter's TSP list. So one strategy to do this is to coordinate your TSP list with your billing software. This will help you avoid submitting any interim claims for practitioners that are not active on the TSP list. And I think it's kind of helpful to offer an example that might illustrate how this comes up. So let's say a practitioner is hired in October, and presumably they start providing care to students right away. but is not on the TSP list until January. That practitioner's costs cannot be included on the CRCS prior to January. So you should also not be submitting any interim claims for that practitioner from October to January. Back to you, Jeremy, with the next slide.
Okay, thank you. The last best practice, or number 4, is to monitor the source of funds from any staff included on the TSP list. As a reminder, staff costs covered 100% by federal sources cannot be included on the CRCS. So any staff paid using federal sources should not be included on the TSP list. You should work with your LEA's HR or finance departments to confirm the non-federal funding sources for eligible practitioners. Next slide. We talked about updating between quarters a little, but what happens when things happen during the quarter? This gets a little complicated. There's some special circumstances around staff turnover. If a TSP leaves mid-quarter, you should set them as vacant. This will make sure that the moments are coded correctly and won't count against you as a missed moment. The other possible benefit is that in the unlikely event that you hire someone during the quarter, you are able to replace that vacancy if they have the same job title and work the same schedule or shift. As always, when you hire a new person, even if they can't fill a TSP vacancy, you will want to make sure they're added to the next possible quarter that they can be added, like in the last example Lisa gave. One more unique circumstance is that you're allowed to have a vacancy at the start of your quarter if you can demonstrate that they will be replaced within 30 calendar days, which means, again, the same work schedule, the same shift, the same job title. While these are not the most common situations, we want you to have every possible option for reimbursement, and this can help you with that. We're dropping a link in the chat to PPL 1930, which covers these options in more detail. We covered a lot today, a lot, from requirements to best practices. So I wanted to leave you with a summary of main points. The TSP list is how billable time is calculated for the CRCS. To that point, there is a one-to-one connection between employed practitioners on the TSP list and being allowed on the CRCS. Another way of saying this is without being on the TSP list, you are not able to claim your cost in the program at all. Finally, make sure to update your TSP list at least quarterly. That's the requirement. But as people leave, mark them vacant. As people are hired, prepare to add them to the next quarter. If you wait until, and Lisa made this point too, if you wait until the crunch period, things can be lost. If you look at your CRCS, each individual person may add hundreds or thousands to your final settlement, and the TSP list is how you get there. I'll turn it back over to Lisa for the next slide.
So we'll be getting to your questions shortly. So please make sure to drop any questions that you have in the chat. We're collecting them. We'll respond to them momentarily. And so before we move into answering questions, please take a couple of moments to answer the quiz questions that are going to be popped up as a poll. So my colleague will open the poll now. So these questions, you were asked them when you registered, and these are a follow-up. These help us gauge the usefulness of this workshop. So we'll leave the poll open for a couple of minutes to allow you a chance to respond. So the questions you see are: 1, why is an accurate TSP list so important for LEA BOP? Number 2 is, what is a best practice for maintaining your LEA's TSP list? And 3, which of the following staff may be included on your TSP list? So we're going to leave it open. Please take a couple minutes to add your responses. Again, appreciate everyone for responding to those quiz questions. I'm going to walk through them with you. So for question 1, 93% of you got the answer correct. The correct answer was B, staff must be on. So the purpose, an accurate TSP list is important because staff must be on the TSP list to include their costs on the CRCS. Great. That was one of our main goals, to convey that information this workshop. So I'm so grateful to see that a lot of you got that question right. So the second question is 83% of you got the answer correct. The correct answer is A. The best practice for maintaining your LEA's TSP list is to update your list quarterly. A lot of you also, I think you were internalizing one of our recommendations is to add practitioners to your internal list the moment they are hired or as part of their onboarding process, but you don't add them to the official TSP list until the 45 days before the quarter starts. So sorry, that one was a little tricky in hindsight. But yeah, so you want to update your list every quarter in advance of the RMTS quarter. And then number 3, it looks like 84% of you got the answer correct, which was C. The following staff that can be included on the TSP list are staff that meet the requirements for the job title, but does not match the list of eligible practitioners. That one was, we acknowledge that one was intentionally worded a little tricky because many of you have pointed out that yes, you must also submit an equivalency form for practitioners whose job titles don't match. So while if you have a practitioner that meets the requirements, but their job title does not match the list of eligible practitioners, they can be included on the TSP list so long as they also have an equivalency form. So a little bit of a tricky one. All right, next slide. All right, now we are getting to your questions and that have been coming in through the chat. So we've been monitoring the chat and we'll try to respond to as many questions as we can. And if we don't get to your question today, we will be responding to all questions after this training. So let me pull up the questions we've received. So we have time, so I'm just going to answer some of the questions that we did answer in the presentation. But so we got one question about mentioning updating TSP lists regularly, and this person currently only does that quarterly. Is that sufficient? Yes, updating your TSP list quarterly is what is required, or certifying it is what's required. Updating it quarterly is sufficient. And I think our best practice that we're suggesting is finding a way to keep track of practitioners that you have hired or that have left the LEA in between those quarters. Jeremy, is there anything you wanted to add to that answer?
We do have a little bit of time, so I'll expand just a little to say that when I was, everything you said is totally true. When I was a coordinator, it was like I just kept my own spreadsheets too. Like, there's no reason you can't keep your own information and really like hire date added to like your LEA's software, date added to RMTS. More information is usually better, and then you'll be able to just really make sure you don't miss out on anybody.
Great. So next question is for clarification, I think the letters are a little bit mixed up, so hopefully I'm interpreting this right. We think you mean a TSP, a time survey participant, should not bill LEA BOP until the first day of the quarter they are added to the TSP.
Yeah, I'm happy to answer that. So technically the answer is yes. So when they start on the TSP list, let's call it January 1, if that was a school day, then then that's when they can start billing. I will just say, which adds a layer of complexity. So if you want to just stop there, yes is the answer. Another layer is technically nothing's going to stop you from submitting claims to Medi-Cal. The problem is you just have to pay that money back. So like mechanically, you can submit a claim, but then when it's all reconciled on the cost report, it essentially counts against you in that equation. So it's not going to like destroy your whole program if you accidentally submit a claim early, but the intention and the design and the best practice is to submit claims while they're on the TSP list only.
Great. Thank you, Jeremy. So this next question is, how does the process work for providers contracted through non-public agencies? I feel like we're covering this in our next workshop.
I was going to say, Jessica, you are like softball up for our next workshop, which is going to be November 6th. And we're going to go into a lot of detail around contractors and including the cost. I will also answer your question here, which is to say that the focus of this workshop was employed practitioners. Employed practitioners go on the TSP list. For contractors, there's still all the same documentation requirements and all of that. They just don't go on the TSP list. Their cost is ultimately added to the CRCS. Another way, I would say directly might be the answer. But all the same requirements, all the same licensing, all kinds of other stuff still exist. It's just there is no TSP list requirement. And November 6th, we'll go into some of the details around that, including how the cost calculation works. So we really get into a lot of detail. And that's true, just also to clarify, that's true for non-public agencies, non-public schools, individual contractors, maybe a contract that you might have with the county or a SELPA. That's just contractors.
We're still working on our response to one of those questions. So I'm going to go back and kind of reiterate this question that I think we can go ahead and answer. What about staff hired in August, but the first quarter they participate in begins October 1st? Can they bill from August until that quarter begins? They are hired in the average quarter. I don't know. I don't quite know what that means, but Jeremy.
I can go into that. So right now, the way the program is designed, and I'm glad this came up because we didn't get into quarter one. Quarter one is average. There is no survey. So there's actually a PPL on this that talks about how to calculate quarter one, and it's part of the CRCS instructions, but I'll summarize it here, which is there is no TSP list for quarter one. So when you create the cost report, you look at your own records and you essentially create that TSP list then, which is to say, oh, we had somebody hired in July, we had somebody hired in August, we had somebody hired in September. I'm going to include their cost because I'm including on a TSP list that you make after the fact. So the way it generally works at the LEA level is you're making your quarter two list and your quarter one list at the same time. Because you're generating that list in the middle of August. So the direct answer to your question is yes, they can bill immediately in quarter one, as long as you remember to put them on your quarter one TSP list, which is a slightly different process.
Great. We have some good questions coming in. Some that are anticipating our November 6th training. So really quickly, I'll just answer a couple questions we got in. Yes, we will be going over the wording that needs to be included in a contract with contractors. That'll be in our November 6th training. And Louisa, yes, we will be posting a link to where you can register for that momentarily. You guys are just ready to talk about contractors, aren't you? So we're just going to finish up some of the questions on, not quite, we're still on questions. One other question that came in is, do we need to have documentation of the service being delivered on a TSP's response to on RMTS. Jeremy, do you want to take this one? Or would you like me to read the response we got?
I'll take it.
Okay.
So the answer is yes. You need documentation because there has to be documentation for an audit. And DHCS may ask for a clarification on a TSP's response. So you'll need documentation to provide that clarification. This could be just to make sure it's coded correctly, or this could be later in an audit. And if it's identified as like a billable or a Medicaid covered service, then it would be important for this program as well. ESMA has their own codes, but we're talking about the DMSP, which is you'll need some kind of supporting documentation for that specific moment. If the provider says something like, I was doing an assessment, then sufficient documentation would probably be the assessment report, just like if you were, essentially trying to prove that service. If you go to the ESMA manual, section 6, which we could link, I can actually get that right now. I'll link that in the chat myself. The rules are actually set forth by ESMA. So I'm putting that in the chat. But it is complicated. I'm not going to pretend like that's a super satisfying answer, but yes, if you think like justifying the service, justifying the time, answering the question. If somebody says they're doing speech therapy, then it seems like the best documentation to have would be evidence of them doing speech therapy. We're getting a bunch of questions. I think we have
time for a couple more.
We still have a couple minutes. Okay.
Yeah, I'll ask the next one. If there are tiers to a job title and we have done an equivalency form on that job, can we include the rest of the tiers? So I'm thinking like behavioral health intern 1, 2, or 3. Or will it require additional equivalency forms? For example, we have done the forms for our mental health specialist 1. Oh, great. You provided examples. Perfect. But we now have mental health specialist 2 and 3. Do I need to do another equivalency form request?
Yeah, I think the answer is yes, unfortunately. And the reason behind that is sometimes the tiers change licensing and qualification. So there could be I don't think DHCS wants to make an assumption that a tier 3 has the same amount of licensing or credentialing as a tier 1. So in that case, you would need to submit individual forms for each tier.
I think we can answer this question. What if a TSP is at work when they have their random moment scheduled? So if it's at the end of the day or they aren't back at their desk and then out for the dates after. I think, Jeremy, this isn't an RMTS training. But
this is not an RMTS training. This is a TSP list training, but I will answer because we have time, which is great. So the random moment time study is structured around adding a TSP to the list and adding their shift. So they shouldn't be after their time because you put in the hours they work. Mistakes happen, things happen, reality happens. Maybe they left early, maybe they're in the restroom. That's okay. There are 18 different codes for everything they do. So whatever they're doing in that moment, including not being there, has a code. So the key is to build that TSP list as accurately as possible, and then the random moments will happen. So it is not your goal to do a qualified activity because it's your time to do a moment. The goal is to answer the questions honestly and accurately, and some of them will be billable, some of them will not be billable.
But Jeremy, can you clarify like the
Sure.
time after a moment that they can respond? Because I think if they're in the moment of work, in the moment they receive their moment, like what are their options?
Oh, when can they respond? Yeah, sorry, they have I've been a little out of the daily grind. I think they have 48 hours to respond.
Rosalie
Um,
said they have 4 student attendance days to
4
respond.
student attendance days. Never mind. Ooh, that's
DHCS, please let us know if that's
again not an
comes up or
RMTS
not.
training, but yes, 4 student attendance days. Thank you in the chat. This is yeah, so they can respond the next day, they can respond the day after. Like there is a timeline to respond, but the moment of what they're doing will be assigned time. Not an RMTS training. I did see the one on the CRCS. Do you want to do that one?
Yeah, I was
last?
getting there. Yep.
Okay.
So I think this is the last question we have until we get one more, but the last question that we have is, when we receive audit reports and have to pay back, is this related to our CRCS report?
Yeah. So the answer is yes. The short answer is yes. All of the reconciliation, and if you go back to the trainings that we linked earlier, the kind of intro to the program and how it works, we go over this in a lot of detail. But I'll just answer it here because again we have time, which is the CRCS is how all of your cost and reimbursement is reconciled to a final settlement number. So if that final settlement number is less than you've already been given, then that's what a payback is. If it's more than you've already been given, then that's an overpayment and they send you more money. So the CRCS, when you talk about an audit or you get an audit report, it is based on the CRCS itself. That's a primary document that this program uses to reconcile cost. I would also go ahead.
No. You can go.
Okay, just right now, the LEA ops team who we're working with, and that's Sarah's team here, is doing technical assistance on the CRCS and technical assistance on the program and things like this. If you received a huge audit and you don't understand why, you don't agree, then definitely sign up for technical assistance. And that process has been going really well. I'll put a link to the technical assistance form right now.
Great. Well, I appreciate all the wonderful questions we've received. I'm gonna thank you all. Thank you, Jeremy. Thank you, Department of Healthcare Services, for helping us answer those questions. Next slide. And that brings us to the next steps and closing for today's workshop. Next slide. So throughout today's presentation, we mentioned many resources available on the LEA BOP website that should be your source materials for understanding how to accurately maintain your TSP list. We're gonna drop a link to where we're gonna drop a bunch of these links in the chat now where you can find these resources. And note that we will be following up with a follow-up email after today's workshop where we will include all of these links. It will be a link-heavy document for you all to have. So the first one is where you can locate policy and procedure letters or PPLs on the DHCS website. We're also including a link to where you can get information about the Random Moment Time Survey, information about past DHCS hosted quarterly stakeholder meetings. It's a great, and then you can also sign up for the email subscription list to get program updates and reminders about quarterly stakeholder meetings. And that's a really great way to stay up to date with program changes or get new information. And then finally, what Jeremy also just shared is a link that you can use to sign up to receive technical assistance from the Department of Healthcare Services by submitting a technical assistance and site visit request form. Next slide. And here is the link that many of you have already been waiting for. So we also have many more upcoming workshops and trainings coming your way. So next month, as we've mentioned, on November 6th, we will have a workshop on coordinating with and billing for contractors. Registration is now open, and we will drop a link in the chat. In December and January, we will be hosting 2 workshops that address the unique needs of small and rural LEAs. So in December, we'll do an introductory workshop to LEA BOP, but that is specifically geared towards the realities of small and rural LEAs. And then we will follow that with a workshop in January that covers up setting up a consortium, which can be a really helpful strategy for small LEAs to participate and share some of the administrative responsibilities for program participation. And then in February, we will host an onboarding webinar for many of you, if you are new to LEA BOP, for new LEA BOP coordinators, those folks that are in the role of managing their LEA's participation in the program. So we hope some of you will join us for those upcoming workshops, and we look forward to seeing you there. Next slide. And with that, I want to thank you all again for participating in today's workshop, asking great questions, responding to our poll. We hope you enjoyed it. We hope you learned something today. So again, thank you so much for your participation, and we look forward to working with you in a workshop coming up. Thank you.